I was considered obese at the time for my height and weight, so I knew I was living a pretty unhealthy lifestyle.
At 46, Bernard Alexander tipped the scale at his heaviest weight ever. His physical inactivity combined with high blood pressure put him at risk for chronic diseases such as diabetes, lung disease, cancer, and heart disease, which ran in his family. So he ran straight to the gym.
It's more of a mental thing than physical. So once I made the commitment that I would join Freedom Fitness and that I would actually attend 5 a.m. classes consistently, that I knew that I was breaking my own barriers.
For many like Bernard, some barriers are put in place due to personal behaviors.
Diet, physical activity, and smoking or tobacco use, those behaviors contribute directly to some of the clinical factors.
But other barriers are caused by health disparities and inequities, which can even influence those personal behaviors.
So a health disparity, for instance, for the chronic disease area would be access to healthy foods. Some people have more access to healthy foods than others. That could be due to unjust, unfair circumstances such as food deserts that exist, or certain individuals within a community might have transportation where others may not.
In Allegheny County, African Americans are more likely to experience such disparities and inequities, in addition to others.
Some of the contributing factors really center around racism. To be quite honest, we have policies that exist, whether they're incarceration policies, whether they're housing policies, or policies in our health systems that disproportionately affect one group of people versus another group of people.
How can people overcome all of these obstacles and live healthier lives like Bernard?
What we will ultimately want is health equity, which means that every single person will have their fair chance, their equal opportunity to attain their full health potential.
Until then,
Try to make healthy choices the first choice. Also, communities and workplaces should create environments that facilitate healthy behaviors. If you are diagnosed with one of the clinical risk factors, you should work with your doctor to make sure that those risk factors are controlled.
Being around a like-minded group of people, there's a lot of people in the gym, some who are older than me, who have lost 125 pounds, 150 pounds over a year or two. It helped with the motivation.